The last 2 hours before you go to sleep are the most important hours of your entire day for your sciatica. Not the morning stretches, not the afternoon walk, the evening. Because what happens to your sciatic nerve in those final hours determines whether it spends the overnight hours in repair mode, healing, recovering, reducing its inflammatory burden, or in damage mode, compressed, inflamed, and waking you up in worse pain than you went to bed with. Most seniors with sciatica spend those final hours making 7 specific mistakes that guarantee damage mode every single night. Tonight, I am showing you all 7, and exactly how to fix every one of them starting tonight. And real quick, if someone you know has sciatica that is always worst first thing in the morning, pause right now and send this video to them. Because the reason their mornings start so badly is almost certainly happening the evening before. And if you are not subscribed yet, hit that subscribe button. Every week, this channel brings you practical solutions that change how your sciatica actually feels. Now let us get into all 7. My name is Dr. Michael Kent, 20 years working with seniors managing sciatica. Your witch. And one of the most consistent things I have noticed in practice is this. Most seniors focus entirely on their morning routine, their stretches, their supplements, their first 30 minutes after waking, and they give almost no thought to the evening, to what they do in the 2 hours before sleep, to what position their sciatic nerve is being held in while they watch television, to what they eat and drink in those final hours, to whether they have done anything to prepare their nerve for overnight recovery. The morning gets all the attention, and the evening quietly undoes all of it. Before the 7 mistakes, a story. Details change to protect privacy. A senior in their late 60s came to me after 14 months of sciatica that was consistently worst every single morning. They described the pattern clearly. By mid-morning, the pain had usually eased to a manageable 3 or 4. By afternoon, it was sometimes even better. But every single morning without exception, they woke up at a 6 or 7, the worst pain of their entire day happening in the first 30 minutes after getting out of bed. We spent our first 2 appointments focused on morning habits, some improvements, but the morning spike persisted. At our 3rd appointment, I changed direction entirely. Tell me exactly what you do from 6 in the evening until you fall asleep. They described it without thinking much about it. Dinner at the table, then straight to the sofa for 3 hours of television, crossed legs the entire time, a long hot shower right before bed, no stretching in the evening, occasionally ice on the lower back if the pain was bad, applied right before lying down, and then straight to sleep. I counted 5 of the 7 mistakes I'm about to describe in that single evening routine. We changed all 5. 2 weeks later, their morning pain score was 2.5. Same morning routine, same supplements, completely different evening. Tonight, every single one of those mistakes. Mistake 1, sinking into a deep, soft sofa after dinner. This is the mistake most seniors make within 30 minutes of finishing dinner, and it sets the tone for everything that follows in the evening. A deep, soft sofa feels like relief after a long day. The cushions sink, the hips drop, the lower back rounds backward, and for the next 2 to 3 hours, while you watch television and think you are resting, your sciatic nerve is being held in a position that compresses the nerve roots in your lumbar spine and tightens the piriformis muscle directly over the nerve in your buttock. When the sofa is too soft and too deep, your hips sink below the level of your knees. Your pelvis tilts backward. The natural curve in your lower back flattens completely, and the spaces through which your sciatic nerve roots exit the spine narrow. 3 hours in this position every evening is 3 hours of consistent nerve compression added to whatever compression accumulated during the day. The fix is simple. Place a firm cushion or folded blanket on your sofa seat before sitting. This raises the hip level, maintains the natural lower back curve, and reduces the nerve compression that deep sofa sitting creates. Alternatively, sit in a firm, upright chair for at least part of your evening rather than the sofa entirely. Your nerve will feel the difference by morning. Mistake 2. Crossing your legs while watching television. Most seniors with sciatica cross their legs habitually while sitting, ankle over knee or knee over knee, and hold that position for extended periods without realizing what it does to the nerve beneath. Crossing the legs creates two specific problems for the sciatic nerve. First, it rotates the pelvis asymmetrically, placing uneven tension on the nerve pathway on the crossed side. Second, it directly compresses the piriformis muscle on the crossed side, tightening it around the sciatic nerve with every minute the position is held. 2 to 3 hours of crossed legs every evening is 2 to 3 hours of consistent piriformis tightening and nerve tension accumulated every single night. By the time you lie down for sleep, the piriformis on the affected side has been squeezing the sciatic nerve for hours, and that compression does not release immediately when you uncross and lie down. It persists into the overnight hours, which is why mornings feel so much worse after evenings of crossed leg sitting. The fix: both feet flat on the floor while sitting in the evening. Check your position every 20 minutes. Place a small reminder, a note, a folded cloth, under one foot if needed to remind yourself. This one change alone produces a meaningful improvement in morning pain for many seniors within the first week. Mistake 3. Taking a long, hot shower right before bed. This one surprises most seniors because a hot shower before bed feels like exactly the right thing to do for sciatica pain. The heat feels soothing, the muscles feel looser, and temporarily, the pain does reduce. But here is what most seniors never consider. A long, hot shower raises your core body temperature significantly. And for sleep to begin properly, for the deep restorative sleep stages where overnight nerve repair occurs, your core temperature needs to drop. When you take a long, hot shower immediately before bed, you delay that temperature drop by 30 to 60 minutes. You spend the first hour of your sleeping period in lighter sleep stages rather than the deep restorative stages your nerve needs for overnight recovery. Lighter sleep means less overnight nerve repair. Less overnight nerve repair means more pain the next morning. The hot shower that felt so soothing becomes a hidden contributor to the morning spike. The fix is simply timing. Take your shower 60 to 90 minutes before bed rather than immediately before. This allows your core temperature to drop naturally in time for sleep, giving you the deep restorative sleep stages your sciatic nerve needs. The shower still feels soothing, but now it helps rather than hinders. Mistake 4. Applying ice right before lying down. Many seniors with sciatica use ice on their lower back or buttock in the evening to manage their pain, and ice has genuine value for reducing localized nerve inflammation. But applying ice immediately before lying down for sleep creates a specific problem that most people never consider. Ice significantly reduces local blood flow to the treated area. That reduced blood flow is exactly what limits inflammation in the short term, and that is why ice helps with acute pain. But when you lie down for sleep immediately after icing, the reduced blood flow persists into the first hours of sleep, limiting the delivery of the oxygen, nutrients, and immune factors that overnight nerve repair depends on. The tissue that needs to repair overnight is the same tissue that has just had its blood supply reduced for the past 20 minutes. The fix: apply ice earlier in the evening, at least 90 minutes before bed, when it provides the anti-inflammatory benefit without interfering with overnight tissue repair circulation. If heat helps your specific sciatica presentation more than ice, a warm pack applied 30 minutes before bed and removed before sleeping is a more repair-supportive evening choice than ice applied immediately before lying down. Mistake 5. Taking evening supplements at the wrong time. Most seniors with sciatica take their supplements in the morning, which makes intuitive sense. But several of the most important supplements for sciatic nerve health produce their maximum benefit when taken in the evening specifically, because their primary mechanisms operate during the overnight repair window rather than during waking hours. Magnesium taken in the morning has largely cleared the system before the overnight hours when it is most needed for pain receptor stabilization and deep sleep quality. Taken 30 minutes before bed, it is present at its peak tissue concentration precisely when the nerve needs it most. Omega-3 fatty acids taken in the morning are processed largely during the day. Taken with the evening meal, their anti-inflammatory metabolites are building in tissue concentration through the overnight hours when inflammatory processes are most active. The fix: move your magnesium supplement to 30 minutes before bed. Move your omega-3 supplement to your evening meal. Keep your morning supplements for those specifically suited to daytime action. Vitamin D, B vitamins, and any energy-supporting supplements. This simple timing shift maximizes the overnight nerve benefit of the supplements you are already taking without adding a single new product or cost. Mistake 6. Skipping the evening walk. Most seniors with sciatica who walk regularly walk in the morning, which is excellent. But the evening walk, even a short, gentle one, provides something the morning walk cannot replace. After a full day of sitting, driving, and reduced movement, the discs in your lumbar spine have compressed under the accumulated load of the day. The nerve roots exiting through those discs are more compressed in the evening than at any other point in the day. The piriformis and surrounding muscles have tightened through hours of sitting, and the intraneural blood flow, the circulation inside the sciatic nerve itself, has reduced through the reduced movement of the afternoon and evening. A 10-minute gentle walk before bed reverses all of this simultaneously. It decompresses the discs, loosens the piriformis, restores the intraneural circulation, and delivers your sciatic nerve to sleep in a mechanically better position than it would be in if you went straight from sofa to bed. 10 minutes, gentle pace, around the block or around the house, every evening, before the shower, before bed, the single most underrated evening habit available for sciatica recovery and the one most seniors skip entirely. Mistake 7. Going to bed without winding down. The final evening mistake is the most overlooked, and it is the one that affects everything that happens to the sciatic nerve overnight, not through any direct mechanical effect, but through the hormonal environment it creates. When you go to bed without an intentional wind-down period, when you go from activity, screen time, or stimulating content directly to lying down, your stress hormone levels remain elevated at the point of sleep onset. Elevated stress hormones at bedtime suppress the deep sleep stages where overnight nerve repair occurs, maintain the inflammatory environment around the sciatic nerve at a higher level than true rest would produce, and reduce the pain threshold recovery that adequate deep sleep provides. The fix is 15 minutes. 15 minutes of intentional wind down before sleep, lights dimmed, no screens, slow breathing, gentle stillness. Not meditation necessarily, just 15 minutes of genuine quiet before your head hits the pillow. This allows stress hormones to drop to their natural nighttime baseline before sleep begins, creating the hormonal environment where genuine overnight nerve recovery becomes possible. Here is your complete evening protocol starting tonight. Sit on a firm surface after dinner, firm cushion on the sofa or an upright chair, both feet flat, no crossed legs. Evening walk 10 minutes before your shower. Shower 60 to 90 minutes before bed, not immediately before. Ice if needed. At least 90 minutes before lying down. Evening supplements, magnesium and omega-3, at dinner or 30 minutes before bed. 15 minutes of quiet wind down before sleep. 7 changes, all of them between dinner and bedtime, all of them free, all of them starting tonight. The patient from our story implemented 5 of these changes. Morning pain from 6 to 2.5 in 2 weeks. Same morning routine, same supplements, different evening because the evening is where the overnight recovery either happens or does not. Now before you go, drop a comment right now. Tell me your age and your city. And tell me, which of these 7 evening mistakes are you making right now? I read every single comment personally. Share this with someone whose sciatica is always worst in the morning. Subscribe and turn on notifications, because every week this channel brings you something equally practical and equally powerful. 7 mistakes, 7 fixes, starting tonight. Your sciatic nerve finally gets the evening it needs to recover overnight. This video is for educational purposes only and is not medical advice. All patient stories have been changed to protect privacy. Individual results vary. Stop any exercise immediately if it produces sharp or worsening pain. Always consult your healthcare provider before making changes to your supplement timing or routine. Dr. Michael Kent is a senior health educator with 20 years of experience, not a licensed physician. Nothing here is intended to diagnose, treat, cure, or prevent any condition. Viewer discretion advised. Viewer.